So let's talk just a little bit about the well child care exam for the toddler age group. The toddler period is defined as 12 months of age to 2 years, and the visits are scheduled at 15, 18, 24, and 30 months. Additional visits have been added to the routine schedule to pay close attention to development and screen for autism. And as we compare the growth that happens in the toddler with that of the infant, toddlers slow down a little bit. And toddlers are going to gain about 4 to 6 pounds a year, grow about 12 centimeters per year, and their height at 2 years correlates well with adult height. It's usually about half of what their height's going to be as an adult. And the occipital frontal circumference, their head circumference, increases about 3 centimeters per year. The posture is real typical of this little guy on the slide, where they have kind of the squat appearance with a pot belly. There's a real decrease in abdominal musculature still, and they have kind of a waddling gait. As we look at their little eyes, the visual acuity is about 20/70, and the most critical thing when you're looking at eyes in toddlers is referral if there's any strabismus, because that should be totally gone by now if they had any wandering eye or any asymmetry in the corneal light reflex or any positive uncover where the eye wanders off. Those children need to be referred to an ophthalmologist. Dental development, about 12 months, they should have 6 to 8 teeth, and this can be variable in children. By 2 years, they have most of their primary teeth. 20 primary teeth should be present by about 2. The dental exams are encouraged as soon as the child has teeth, but definitely toddlers should be seen. They should begin to brush their teeth, and just a little smear of fluoride toothpaste is appropriate, as you heard with your training in the cavity-free at 3. And absolutely want to avoid bottle to bed and any sugary drinks bathing their teeth all day. Neurological development really explode during this age group, and the brain cells are all present at 12 months, but they increase in size and the complexity of the brain develops. So by 2 years of age, they have about 75% of their brain growth complete, but their little attention span increases during this age group a lot. And we also have myelinization of the cord that's complete at 2, and that's really one of the prerequisites for potty training, and we can let parents know that. The immune system also begins to mature during toddlers, and it really results in a decreased risk for serious infections. And you'll notice that as the body matures and the immune system becomes more mature, there's less frequent otitis media, and there's decreased severity of upper respiratory infections. Their immune system responds better when they get an infection. Tonsillitis remains prevalent, and the tonsillar hypertrophy continues to be very common at this age. But their immune system really is developing. And the IgG and IgM reach adult levels by 2, and there's a gradual increase in the IgA, IgE, and IgD. They peak later in childhood, but everything is maturing, and that's good news for fighting infections in this age group. The cardiac system is also changing, and if you think of just increase in size, so that the heart is a bigger size so it can pump more blood, so the rate can decrease. The lungs are bigger, so they can exchange more gases, and so the respiratory rate decreases. And because that heart is bigger in size and has a larger volume of blood pumping, the blood pressure goes up. When we think about the GI system in the toddler, we know that they have more enzymes for digestion at 4 to 6 months, and that's when we suggest starting solids. They now have the enzymes present to digest those solids. We also know there's an increased acidity in the stomach acids, which destroys bacteria, so they don't become as vulnerable to GI infections and dehydration. And the really good news for the mom's sleep is that the stomach volume increases in size, and so the child can now get away with 3 meals and 2 to 3 snacks per day. The GU system is also maturing, and this allows the child to have a little less vulnerability to dehydration. The kidneys now can concentrate some urine. The skin protects some of the water loss as well with the increased subcutaneous fat. There's increased protection and increased temperature control. Bowel and bladder control is possible around 18 to 24 months. And again, we need the increased attention span, and we also need the myelinization of the cord to take place. But usually that happens around 18 to 24 months. Development-wise, the gross motor, the child at 12 months should be able to stand alone, walking around furniture. By 15 months, most children are able to walk on their own. At 18 months, they're running with some falling. At 2 years, they should be able to kick a ball forward, throw the ball overhand, climb up some stairs. And at 2.5, they should be able to jump and ride a bike or tricycle. Fine motor, at 12 months they can pick up a raisin or a bit of a pincer grasp to pick up a small Cheerio, and you can see the little guy in the upper right hand corner is demonstrating that for you. They should be able to have enough coordination to bang 2 blocks together. At 15 months they can actually take a crayon and scribble like our little guy at the bottom of this slide in the center. They should be able to stack a couple blocks on top of each other and dump some small object from a bottle after you show them how it works. At 18 months, they should be able to build 3 or 4 blocks and also get the raisin out of the bottle without you showing them. And our little guy in the lower left-hand corner is demonstrating stacking the blocks for you. At 2, they should be able to build 8 blocks, draw a vertical line, and also have some circular strokes. And at 2.5, they should be able to imitate a circle if you demonstrate for them. Language development explodes in toddlers, and at 12 months, they usually have a mama, dada, specific to their parents and understand more than that. At 15 months, they continue to have the mama, dada, and culturally specific terms as well for those who primary language is not English, and 3 additional words, and they usually know their name. When you call their name, they know you're talking to them. At 18 months, they begin to combine 2-word sentences. They should be able to point to body parts. Where's your nose? Where's your eyes? Where's your hair? They should also be able to name pictures. If you point to the doggy, they should be able to tell you that's a dog. And they should be able to follow simple instructions. At 2, their vocabulary is about 300 words, and they start to have increased complexity of their sentences and will begin to use some plurals. At 2.5, there's just increased complexity and also increased comprehension. Personal social development also explodes during the toddler period. So at 12 months, they should be able to drink from a cup, indicate their wants with either pointing or grunting without the crying periods that happen with the infant. The only way the infant can communicate is through crying. The toddler begins to understand there's other ways to indicate needs, and they should be able to play ball. At 15 months, they begin to imitate. So if mom's doing housework or dad's working in the yard, those things they will imitate. They should be able to feed themselves with a spoon. They should, not neatly, but they should be able to feed themselves with a spoon, undress with some simple clothing, and they will play alone for a few seconds on their own, a few minutes possibly, but it's parallel play. They don't interact. So toddlers will sit beside each other but play alone. And at 18 months, they're helping with simple tasks. Can you pick up your toys? Can you put this in the trash? Those sorts of things. They should be able to undress and maybe getting a little more complex undressing, like unzipping clothes, and they like sandbox and feeling different textures. At 2, they begin to dress with help. Again, if it's simple clothing, pulling a t-shirt over their heads, or helping with simple things. They should be able to wash their hands and play tag with others. At 2.5, they should be able to dress themselves, and again, that's with simple things like sweats or that kind of stuff that's not real complicated with buttons and zippers and all that, and then separate just a little more easily. So as we review the psychosocial development that happens in the toddler age group, we can kind of remember that the tasks of this age group are to separate themselves from others, to learn to be able to delay their gratification, and gain control of their bodily functions. Another important thing that occurs in toddlers is they learn socially acceptable behavior and begin really to develop their verbal communication, and that really allows them to interact with others. So Erickson described this as autonomy versus shame and doubt, and the task is ego development. And the toddler uses negativism and rituals to establish this autonomy. So temper tantrums are common, and no is their favorite word. And we also know their early conscious develops during this time, mostly related to fear of punishment, but they begin to understand what the difference between right and wrong. Freud talks about the anal stage for toddlers being from 18 months to 3 years and focuses mostly on toilet training. The cognitive development, and Piaget described this pre-operational phase with trial and error, early thinking and reasoning, begin to develop some concepts of space, time, and causality. And the sensory motor and preconceptual phases last from 12 to 24 months, and it's primitive reasoning, it's experimentation to achieve goals, and it's that 18 to 24 month old that really begins to develop the object permanence. And then the 2 to 4 year old, moving more into the preschool age, is the preconceptual. And their moral development begins, their socialization begins, and they ask lots of how and why questions. They're really not able to empathize with the victim or reason yet, but they will get there. And Kohlberg talks about the moral development being the most basic level in toddlers, where discipline's important to their moral development, and they follow the rules out of fear of punishment, which we mentioned already. Spiritual development also begins to develop, and if there are bedtime rituals that are comforting, in some cultures, prayer at bedtime is an important part, transition objects. Some of our Hispanic families have little crosses and medals at the bedside, and And so spiritual development is an important component in some cultures as well. The anticipatory guidance for the toddler visit, we want to talk about the principles of discipline, and you really want to encourage families to reinforce positive behavior, praise the child verbally and with attention, and being very consistent. If they're going for the electric outlet, you can't let them stick a key in there. They'll get shocked, they'll get burned. We have to be consistent every single time. And of course, to try to remove those enticing things by using the outlet covers. You have to have clear and reasonable rules that a toddler can understand. You have to be firm, not too kind, but very firm with those. And then timing needs to happen as soon as possible, right when the behavior occurs. And then give the child a friendly reminder. So the child that's heading for the electric outlet, you have to say, oh no, remember, we don't play with that. And then unity refers to all caregivers on the same page. So if there's a specific rule that you're trying to teach the toddler, grandma can't let them get away with that behavior, or dad can't let them get away with that behavior. There needs to be commitment and follow through even when the parents are tired. So if for example, if the rule is that the child has to pick up their toys when they're done, even when they're tired, they need to help the child get the toys back in the basket. The other thing that really helps parents with toddlers not get frustrated is to prepare the child and explain the consequences, like give multiple warnings, and then to try to make the environment as safe for a toddler as possible so that you don't have to have consequences. And so moving breakable objects and reviewing expected behavior. You can't run around in the library. You can't scream in the library. Be aware that they can get overexcited or fatigued, which is really hard for them to control their behavior then. And then offer explanations for your disappointments and how you'll know that they'll do better next time. The next principle that I like to mention is flexibility, and that can be appropriate to the child's temperament and the severity of the situation. So for some children, being a little more flexible around what the rules are, or what the routine is, or whatever is expected, can be helpful for some kids' temperaments. They just can't adjust to real rigid routines or real rigid expectations. And then privacy, when you're disciplining the child, make sure they understand what they did wrong and what the consequences are. And at this age, timeout works pretty well. 1 minute for a 1-year-old, 2 minutes for a 2-year-old. And then when it's over, termination. You don't bring it up again. They've already been punished. So you don't say, boy, you were really naughty this morning and I had to put you in timeout. You just remind them that if you do that, you know there is a consequence of timeout. And then toilet training is a common concern of parents at this toddler visit. And there are varying theories, and frequently students like to do their anticipatory guidance paper on toilet training. But in general, there's some theories, and Brazelton has a theory that 2.5 to 3-year-olds will train themselves without parental intervention, so just relax and let it happen naturally. Most kids develop voluntary control after they're walking. So in that 18 to 24-month-old, they recognize the urge to go and they're able to hold it for a couple of minutes. They can communicate the sensation to parents, and they have a desire to please their parents. And you can also look for readiness in a child for toilet training if they're able to hold the urine for a couple hours at a time, so they go a couple hours in between wet diapers. If their bowel movements are decreased to 1 to 2 per day, and if they walk well by themselves, if they sit still for 5 minutes, if they're able to undress, pull their little pants down, and if they're aware of elimination. So many times the toddler who knows they're going to have a bowel movement will go hide behind a couch or in a corner and kind of squat down. They're aware of what's going on. Then they have to be able to communicate it to parents. And if there's a change going on, a stress in the home or an illness, that's not a good time to start toilet training. So for those parents who want to initiate toilet training, the suggestions are to get a potty chair, talk about stool or bowel movements and pee in the potty. And then there are books available, there's videos, they can watch others. If they're older children, they can go with them in the bathroom and watch to them. Usually bowel training occurs before bladder. There are some strategies that use the doll and show the doll going pee in the potty. Just warn parents that accidents are extremely common and that you reward good behavior and don't punish the accidents because they're just common. Another thing that occurs frequently in the toddler visit is the parents may be planning to expand the family. So sibling rivalry is a common thing that occurs. If they're preparing for the birth of a new baby, you can talk about that. Encourage the toddler to participate with the care as is safe, and somehow fit in some time and attention for the toddler without the infant, and allow the toddler to talk about their feelings. Nutrition-wise, the caloric requirement for the toddler decreases to 100 kilocalories per kilo, and the fluid requirement decreases to 115 milliliters per kilo. And as we mentioned before, this child can usually be transitioned to 3 meals plus 2 or 3 snacks per day. And parents should be encouraged to limit the continuous grazing. So the child should sit at the high chair or the table with the family during meals and sit and eat until full, and then there's no other eating until the child has the next meal and or snack. The child should be offered the 4 food groups, and a good rule of thumb about size of servings of those 4 food groups is 1 tablespoon of each of the 4 food groups per year. So if you have a 2-year-old who's eating, they get 2 tablespoons of applesauce, 2 tablespoons of some kind of protein, whether, it might be peanut butter on a half sandwich or something like that. So just making sure families know the right size of servings, because they shouldn't have a full adult size serving of like the spaghetti on this toddler's plate. We want to limit their milk to 1 quart per day. And if we're giving more than 1 quart per day, that's limiting the solids they intake and leads to iron deficiency anemia. And this is an extremely common problem in this age group. So we really want them to start iron-rich solids and limit milk. Kids at this age become very picky eaters and binge eaters. So they may eat the very same thing, breakfast, lunch, and dinner, for weeks on end. And that's just normal in this age group. But it's really important for parents to know they need to offer nutritious options and limit the junk foods that they give the kid. They should be able to feed themselves, but they're very messy eaters. They like finger food, and they need to explore and make a mess and learn to feed themselves for their own development. The other important thing to emphasize at the toddler visit is this child still needs 12 hours of sleep per night, and that rituals and transition objects can be helpful at bedtime and aid with the transition to sleep. They usually still need 1 nap per day, and they're very active when they're awake. Children who don't get enough sleep tend to be very irritable, and that's something toddlers already kind of get a bad rap for being irritable or terrible too. So we want to make sure they're getting enough sleep. Safety is a major concern at this age group too. Accidents are the leading cause of death in the toddlers and early preschoolers, with the most common injuries coming from falls, contusions and bites, poisoning. Sunburn happens frequently, especially in Colorado. Motor vehicle accidents can be one of the top causes of death. And burns, drowning, and other choking, putting everything in their mouth. So we really want to talk about toddler-proofing a home. Ingestions are incredibly common in this age group. Everything they find goes into their mouth. We saw a dramatic improvement in the number of ingestions in toddlers with child-proof packaging. But still, 90% of all ingestions occur at the child's home, with the other 10% occurring somewhere the child is frequently, like grandparents or daycare. And prevention is our very best treatment. So parents should get down at the child's level and see what they're looking at that's going to entice them. Look at where they store cleaning products, medicines, garden products. Some plants are poisonous. Cabinets should be locked or have the toddler-proof latches on them. They should also look at the garage and the basements, and don't store liquids in pop bottles. So ingestions, the treatment principles, really we encourage families to have poison control center number helpful or available and call them right away. And with corrosives, the child should dilute with water and call poison control. Drain cleaners, toilet cleaners, dishwasher detergent, batteries, the diabetes testing tablets, denture cleaners, and bleach, all of those can be very corrosive. So you dilute with water, call poison control. They'll coach you on whether or not a child needs to be seen. With volatile substances, things like gasoline, turpentine, furniture polish, lamp oils that smell good, we really want to monitor respiratory status over time. And the respiratory distress doesn't start right away. It usually develops later on, but these children need to be monitored very carefully. Common ingestions, aspirin is one that can cause lots of problems, and parents think it's pretty benign. But you need to know that 7 adult or 28 baby aspirin are lethal. And since we're encouraging a lot of our grandparents to be taking a baby aspirin for prevention, those can be in the grandparents' home. So we have to make sure, and they taste good. They're just pretty tasty. So the child will sit there and eat the whole bottle, and that actually can be life-threatening. There has been a decrease in incidence since we treat most infants and toddlers with Tylenol because of the risk of Reye syndrome with aspirin, but still they are available for older people as prevention, so they can be ingested. There's also the possibility of chronic ingestion because it's in a lot of other products. So you want to ask about what cold preparations and what other products they might be using that may have aspirin in them. Usually the symptoms appear within 6 hours after the ingestion, and it's hyperventilation, anorexia, vomiting. They may become very diaphoretic. They can have GI bleeding. There's increased metabolism and increased temperature. And your diagnosis for aspirin poisoning is a salicylate level. The treatment, if you catch it early before it's all been absorbed, you can give magnesium sulfate. And if it's later, IV treatment of electrolyte imbalance and acid-base imbalance is important. So you're going to call poison control, and you're going to report what the child ingested and follow the instructions they give you. Many times referral to the emergency department is suggested, or urgent care for children who have an ingestion. And treatment there can be activated charcoal, cathartics, and if there's an antidote for what they've ingested, that will be given as well. So anti-venom for poisonous bites, mucomist for Tylenol, oxygen for carbon monoxide, and Narcan if it's a narcotic overdose. The hydrocarbons, as we mentioned earlier, typically are things that kind of smell good to the kid, and especially if they're stored in the wrong container can be very enticing. So the danger there is aspiration, and it can cause chemical pneumonitis. So the treatment is a chest x-ray and observing for 6 hours, and if the child's having respiratory distress, they'll be admitted. Tylenol ingestion, again, the treatment's going to be the activated charcoal and the cathartics. And the anticipatory guidance and screening sorts of things that happen in the toddler visit. We want to screen for development, which we've talked quite a bit about. We want to screen for vision and hearing. We're going to get hemoglobin to look for anemia. You're going to ask the questions around tuberculosis exposure and get a lead screening. The immunizations are specific to the age of the toddler, and you're going to go with the specific recommendations. But typically, the toddler needs a DTaP, a Hib, their MMR and varicella, and those have to be given after the first birthday. So they'll have to be repeated if you give them early. And then we give the Prevnar, the IPV, the Hep A, and yearly influenza. So needless to say, the toddler's not too wild about us after this visit. So that is an overview of the toddler well-child visit, and I hope you have fun seeing toddlers.